Dear committee members and dear audience, welcome everyone on the 3 months progress report. I would like to present my PhD thesis, Innovative Multimodal Imaging Techniques in Dermatology. My name is Noémi Varga. I'm a medical doctor and an MD PhD student at the Department of Dermatology, Venerology and Dermato-Oncology, Semmelweis University. My supervisors are Norbert Kiss and Marta Medvec. My SMS is Fanny Adél Meznaric, and I'm from the Dermatology Immunology group. Our vision is to improve the survival of skin tumors, and to achieve this vision, our mission is to promote the implementation of novel imaging techniques in clinical practice. We set specific goals and 2 projects. Both of them are systematic reviews and meta-analysis. Our first project is comparing the efficacy of imaging modalities for the diagnosis of malignant melanoma, and my co-investigator is Lili Gulyás. Malignant melanoma is a melanocytic tumor that is responsible for most of the skin cancer-related death, with an estimated death of nearly 8,000 people. The main reason for low survival rate is delayed therapy, and therefore early diagnosis is crucial for melanoma patients. So there is an unmet need to find new diagnostic techniques. Dermoscopy is the currently used non-invasive method for melanoma diagnosis. However, it has several drawbacks. For example, it is examiner dependent and it has limited diagnostic reliability. Novel non-invasive optical diagnostic techniques use the special properties of light and photons to obtain more detailed and higher resolution images of the skin, and to get additional objective information of the skin. So therefore, our aim is to compare the diagnostic accuracy of non-invasive optical diagnostic techniques for the detection of malignant melanoma. Our clinical question is, which is the most accurate non-invasive optical diagnostic tool for the detection of malignant melanoma? We use the paired framework, where the population is patients with suspected melanoma. Index test is non-invasive optical diagnostic techniques. Reference test is histology, and the diagnosis of interest is malignant melanoma. Our hypothesis is that novel non-invasive optical diagnostic techniques have better diagnostic accuracy than conventional dermoscopy. The clinical implication of this project is that identifying melanoma at an early stage can increase the survival of melanoma patients. We conducted a systematic search on the 15th of November, and we used the search key above. It has 3 domains. The first one is about melanoma, the second one is diagnosis and detection, and in the third domain we collected all the non-invasive optical diagnostic techniques for detecting melanoma. We searched in the 3 main databases. We collected 6 key articles, which we grouped according to the non-invasive diagnostic techniques which they used in the study. In these 3 cases, they used reflectance confocal microscopy, and the diagnostic accuracy measurements, we used the sensitivity and specificity, which you can see it's very high in this case of this technique. The second one is dermoscopy, and we also used here the same paired framework, and here you can see that the diagnostic accuracy became lower than in case of the reflectance confocal microscopy. Here you can see the flowchart of selection. Before the duplicate removal, we had more than 16,000 articles, and after duplicate removal, we got 11,000 articles. So here is the progress of the first project. We are at the stage of the title abstract selection, which we started both with, with my co-investigator and my TD students. The second project is comparing the diagnostic accuracy of imaging techniques for assessing Breslow thickness in malignant melanoma. It's also a systematic review and a meta-analysis, and my co-investigator here is also Lili Gulyás. As I said previously, one of the most dangerous cancers is melanoma, and early diagnosis and treatment can lead to a better survival of melanoma patients, so therefore early staging is crucial. The stage of the melanoma is primarily established based on the Breslow thickness. However, it is not available at the initial clinical diagnosis. The accurate preoperative prediction of Breslow thickness can determine the exact surgical margin for the tumors and the need for sentinel lymph node biopsy at the same time as primary surgery. And it also sets out further imaging procedures such as PET-CT and MRI. So there is an unmet need to find also here new diagnostic techniques. Our aim is to compare the diagnostic accuracy of these non-invasive diagnostic techniques for the preoperative prediction of Breslow thickness in malignant melanoma. Our clinical question is, which is the most accurate non-invasive diagnostic tool for the preoperative prediction of Breslow thickness in malignant melanoma? Here we also use the paired framework, where the population was patients with malignant melanoma. Index test is non-invasive diagnostic techniques, and reference test here also histology, and the diagnosis of interest is the overall diagnosis of Breslow thickness. Our hypothesis is that the diagnostic accuracy of non-invasive diagnostic techniques is non-inferior to the histological evaluation in the preoperative determination of Breslow thickness. And the clinical implication here is the same case. Faster staging and therapy can also lead to an increasing survival rate of melanoma patients. We conducted the preliminary research, and we also used the three main databases in here, in this case also. And our preliminary research key has also three domains. The first one also about melanoma, the second one is about Breslow and thickness, and the third one, here we collected all the non-invasive diagnostic techniques. Our second project seems to be feasible, and here you can see the summary of our aims. We would like to submit both of our projects next year. I would like to say goodbye with the quote of J.K. Rowling. It's important to remember that we all have magic inside of us, and thank you for your attention.
Congratulations on your presentation. It was great. My question is regarding your first project. You mentioned the population is patients with suspected melanoma. And how would you define suspected melanoma?
Thank you for your question. It's a really good question. We also faced this problem during the title abstract selection, and I have to define it for my TDK student and co-investigator also. So we are interested in articles which are about suspected pigmented lesions, which can be other types of skin disorders, for example, seborrheic keratosis or simple nevus, or also malignant melanoma or pigmented basal cell carcinoma. So yeah, we are collecting articles which contain pigmented skin lesions which are suspect for melanoma, and that's the answer.
Thank you. Thank you for your answer.
So first of all, congrats on your great projects. And I would like to ask you about the Breslow thickness, which you said that it was a very important tool in the staging. And I'm interested in how do you measure the Breslow thickness, and also if the lateral extent of the tumor is also important.
Thank you for your question. Yeah, it's a very good question. So Breslow thickness is a histological definition, actually. So Breslow is measured by a histopathologist after the excision was made. And the lateral extent of the melanoma is not as important as in other types of cancer. Here, the perpendicular invasion of the tumor is more important because melanoma has a specific characteristic that it can metastatize very soon. It doesn't matter if you find a laterally extent melanoma, it can be very shallow. But that it also can be that it's very superficial, the melanoma, and the lateral extent is very big. So the Breslow is more important in staging and the metastatic potential of the tumor than the lateral distance of the tumor.
Thank you.
Congrats on your very good presentation. I had a question on the first project. So do you plan to compare non-invasive diagnostic techniques to dermoscopy, or both of them compared to histology?
Thank you for your question. we would like to compare to the conventional gold standard method to dermoscopy, the other optical non-invasive diagnostic techniques. Histology is important for the articles. I mean, we are collecting articles which include histology as a 0 point, as a set point. So in articles, they compare every kind of optical diagnostic techniques to the histology. So, for example, reflectance confocal microscopy, and after that, they confirm the exact dermatological diagnosis to histology. And after that, we would like to compare the other optical diagnostic techniques to dermoscopy.
May I? Congratulations, fantastic talk. Well, who was Breslow? Or who is Breslow?
It's a very good question.
Of course, it's a very good question.
I haven't even think about it, but I think as I get home, I will check it.
Poor Breslow, you know,
it's the first time.
I really feel sorry for him or her. I don't know, because I don't know who Breslow was, but I'm sure he must be a famous physician. And regarding your second topic again, what does it mean that feasibility up to 90%? To me, it's an on-off, right? It's either feasible or not.
Yes, yeah. Actually, this is a count which we discussed in the dermatology and the immunology group, and our SMS advised to indicate it like this. It's not completed the feasibility stage, but it will remain it shortly. Actually, we have this preliminary search key, which seems to be very good because we collected all the non-invasive diagnostic techniques. And also, I found several key articles regarding this topic. And yeah, it needs to be, we need to summarize that, and after that we can make the prosper registration. So this means the 90%.